as everybody's getting comfortable. So this is a very exciting day for us. So I'll get started. Good afternoon, everybody, guests, friends, Gray Panthers. I'm Michelle Arnaud, Vice President of Gray Panthers NYC, and welcome to the September 26th, 2023 edition of Transformation Tuesdays. Happy fall. So just a little background about our webinar. The Gray Panthers launched our virtual Transformation Tuesday monthly series in July 2021 to offer a safe space for open discussion about the transformation of nursing homes and long-term care. And then from May through August this year, my co-chair, Carrie Lil Chadal, and I have had the privilege of hosting the Unity subset of Transformation Tuesdays. We invited panels of experts with the intention of fostering open dialogue among advocates, industry experts, residents, and long-term care partners. We hope we've made some progress in opening the lines of communication, and we understand fully and accept that there's much work yet to be done. As our president, Jack Kupferman, likes to remind us, our role here at Gray Panthers NYC is to act as a catalyst for change. But today we're going to shift our focus to expressing gratitude to a group of deserving individuals who worked in facilities during the height of the pandemic. We have 6 honorees and 7 runners-up. In July, we announced the Above and Beyond Award in order to describe how these selfless people carried on their duties in looking after our most vulnerable population, who were in lockdown, alone, confused, cut off from loved ones before vaccinations were available. We put out the word and we received an amazing onslaught of nominations from around the country. As you know, 2 years ago, we produced a documentary entitled Honoring Nursing Home Lives Lost in order to offer the bereaved the opportunity to express their grief. Now we're going to shine a spotlight on those who looked after the most vulnerable, those people who were working during a desperate time. And we will also hear from 2 operators of independent facilities. Believe me, it was difficult to winnow down the names that were submitted. We were so touched by all the hardworking people who were nominated. We salute you all. Through the generosity of our awesome donors, we allocated some funds in order to offer an honorarium to 6 amazing candidates. In addition, Senator Gillibrand, who sent her regrets today, will be sending a personal letter of gratitude to each one of our 6 honorees. But before we meet these outstanding folks, we want to welcome 2 outstanding advocates to our virtual podium. Lori Smetanka, Executive Director, National Consumer Voice for Quality Long-Term Care, who will be followed by Rick Gamache, Chief Executive Officer, Alders Bridge Communities, a not-for-profit continuum of care for older adults across Rhode Island. In her role as Executive Director, Lori Smetanka oversees and contributes to the organization's policy, advocacy, and program activities. She leads fundraising efforts, she establishes strategic partnerships, and she establishes the direction of the organization. Before joining National Consumer Voice, Lori served as the Director of the National Long-Term Care Ombudsman Resource Center. And now it's my pleasure to pass the virtual mic to Lori. Lori,
thanks. Thanks so much, Michelle, and thanks to you, Carrie, Jack, and all of the team at Gray Panthers for having me be with you today. I'm excited to be here, and I'd like to offer a big congratulations to the recipients of the Gray Panthers Above and Beyond Awards. Not only are they individually deserving of the praise and recognition that they're receiving today, but they're great representatives of the hundreds of thousands of their colleagues who work in nursing homes and provide the care, support, and comfort to residents who live there. For many residents, the majority of whom do not have family or regular visitors, the staff become friends and de facto family. This became particularly true during the pandemic when, as you know, families and other visitors were not permitted in nursing homes. The staff were and are the people that residents rely on to a great extent, not only for help with all of the daily care that they need, but also to celebrate birthdays and holidays, to share successes and goals and preferences and things and topics of interest, and also to hold their hand when they're sick or dying. Staff members not only provide assistance with eating, bathing, dressing, medications, going to the bathroom, and other types of personal care. They're often the first to know when there's a change in a resident's condition. They know what may trigger an individual to be afraid or upset, and they often know how to redirect or soothe them when they show signs of distress. This is part of what it means to provide person-centered or person-directed care, and are important factors in the provision of quality care. In too many nursing homes today, however, quality and person-centered care are lacking or limited because there are not enough staff. When there are not enough staff available, basic care needs may go unmet, and the quality of care plummets, and both the resident and the staff person are put at risk of harm. Strong federal standards requiring minimum staffing levels do not currently exist, and state standards we know are inadequate. So as part of the president's proposals to improve quality and safety in nursing homes, Centers for Medicare and Medicaid Services, the federal agency overseeing nursing homes, just released proposed rules for setting minimum standards. And while we appreciate the administration's attention to these issues, we think these proposed rules do not go far enough to ensure that residents' basic care needs are met and that they will in fact receive quality care and services. The proposed standards are well below levels that evidence-based research says is necessary to ensure basic care and to minimize omissions of care. They also will allow waivers for facilities that meet certain criteria, and yet they don't require any changes in operation or monitoring to ensure that residents are not being harmed. So we, all of us collectively, have an opportunity to weigh in on these proposed rules during a comment period that's open until November 6th. You can get more information about how and where to comment on the Consumer Voices website at theconsumervoice.org. And I would encourage you to submit comments and letters sharing your experiences, what staffing is good, as well as when it's not. And tell the administration that we need staffing levels based on solid evidence and supports the provision of quality care. The residents' and staff well-being certainly depends on it. We know that based on what we'll be hearing about the successes from the staff today and the relationships and the interactions that they've had with the residents that they work with, that it's incumbent upon all of us to ensure that there are adequate staff and they are fully supported in being able to achieve and provide proper care and services to residents in long-term care facilities. And I look forward to hearing more about today's honorees and also the other speakers. So thank you so much for having me today.
Thank you, Lori, for reminding us that we still have a lot of work ahead. If you could maybe put something in the chat about how we can access this information, then everybody can take the action after this webinar.
Sure, absolutely.
Thank you. And now allow me to introduce Rick Gamache. He is the CEO of Aldersbridge Communities, a not-for-profit continuum of care for older adults in Rhode Island. Since 1981, he's worked in the aging services field. His career has been equally split between for-profit and not-for-profit companies and has included nursing homes, assisted living communities in 4 states, home care hospice, and the first 2 senior-friendly emergency rooms in New England. He teaches long-term care at Rhode Island College, serves on the board for Leading Age Rhode Island and the Rhode Island Quality Institute. He's a member of the Live Oak Project and the Moving Forward Coalition, both dedicated to the redesign and reimagining of long-term care in America. And in 2009, he was chosen as the National Distinguished Administrator by the American College of Healthcare Administrators. Recently, the governor of Rhode Island appointed him to the Board of Examiners for Nursing Home Administrators. And now it's my honor to pass the floor to Rick Gamache.
Thank you so much, Michelle. Thank you to the Gray Panthers. Good afternoon, ladies and gentlemen. We are in the company of greatness today. The individuals who are being recognized for going above and beyond are but a sample of the thousands upon thousands of kind, empathetic people who stepped forward during the COVID pandemic with courage and compassion to care for the most vulnerable members of our population during a time when our nation was caught unprepared for a deadly disease that claimed the lives of more than 1 million Americans. 200,000 of those who died lived or worked in nursing homes. That's nearly 1 in 5 COVID deaths. That statistic is staggering, especially considering the nursing home population is roughly 1/2 of 1% of the total population. And this disease did not discriminate. It took the lives of those in 5-star nursing homes and 1-star nursing homes, for-profit organizations and not-for-profit organizations. And right now, there's a lot of activity aimed at getting the government to make changes so it doesn't happen again. But I fear that 2 of the primary reasons COVID accelerated through nursing homes are being overlooked. And if we don't address these failures, we are just as vulnerable today as we were in March of 2020 when COVID began to spread. The first systemic failure may be a bit of a surprise to some, but it's been well researched. Nursing homes aren't designed to mitigate the spread of infection. In fact, the environments make it nearly impossible for staff to contain infectious disease. Shared rooms with 2, 3, or even 4 vulnerable residents living together, with a shared bathroom, sometimes shared with 2, 3, or 4 health-compromised elders in the next room, all using the same toilet and sink multiple times per day. And in the shower room, that, by the way, is at the end of the hall, and it's shared by 30, 40, 50, even 60 residents. The environment has always been a disaster waiting to happen, and it happened with COVID. Most nursing homes were built in the early 1970s using regulations that were adopted by our federal government in 1965. And maybe back then, the idea of an 85-year-old living as if they were in a college dorm was acceptable. The model was based on old hospital regulations. And not only did it contribute to the deadly spread of COVID, but it's inhumane. No one wants to share a room with a stranger, but that's the way many elders are forced to live. The second factor that accelerated the spread of the pandemic within nursing homes was the staff. COVID often spread asymptomatically, meaning that someone could be contagious without any sign of illness. I'm sure it doesn't surprise anyone on this call that most of the staff in nursing homes are vastly underpaid. Many hands-on caregivers live on the edge of poverty, and they often need second or even third jobs to make ends meet, provide food for their families, keep the utilities on at home. During the pandemic, as caregivers left one job and went to another, they often unknowingly brought COVID with them. I often wonder if they had been paid a living wage to begin with, how many lives might have been saved. These 2 systemic failures must be addressed: private rooms for elders and living wages for staff. Private rooms for elders and living wages for staff. Those need to be central themes for any efforts at nursing home reform and redesign. Some progressive-minded groups are trying to make this happen. The Moving Forward Coalition, a cross-section of advocates and stakeholders from across the country, are attempting to transform elder care using a report from the National Academy of Science, Engineering, and Medicine as a guide. Another group, the Live Oak Project, a think tank of elder care activists and experts, including Gray Panthers President Jack Kupferman, came up with a similar plan. Both groups continue to make inroads with Congress, CMS, HUD, and others, but it is a long, slow, muddy path that they travel to get there. Today, I hoped to provide you with an understanding of some of the obstacles to safe quality care that our award winners face every day. Bad environments, low salaries. Despite these challenges, there are people like our honorees that come back every day and continue to rise above. Their example shows us all that there is a better way, and that the system they work in must be transformed into something worthy of the people it's designed to serve. These honorees represent the best of humanity. They are some of the finest human beings we will ever encounter. The way they conduct themselves as caregivers lights a path for us all to follow. When they provide comfort and care to a resident, they're practicing skills that are in short supply in our country today. They are patient, gentle, respectful, and loving. And I'm sure that when they go home to their families at the end of a workday, they are also patient, gentle, respectful, and loving. They not only make life better for our elders, but they also make our world better by role modeling the best humanity has to offer. I've worked in nursing homes for 42 years. There have been many times when I've been disappointed and angry with certain behaviors and practices by some in my profession and by many aspects of this dysfunctional, failed system. Many times I've considered quitting. I'll bet these award winners have felt the same way. But I also get to work with people like those being honored today, people who give of themselves day after day to make life better for those who are less fortunate. I get to work with people who demonstrate what it truly means to be human. They inspire me to be a better person. They inspire me to be a stronger advocate for elders and for those who care for them. Working with people such as these during COVID renewed my faith in humanity. I remember when COVID first hit our community. It was long before vaccines were available. Nobody knew much about it other than that it was deadly. I heard stories of other nursing homes where the staff walked out when COVID appeared. I asked our staff if any of them would volunteer to take care of our residents with COVID, and hands went up. A nursing assistant said, "Those are our residents. We'll take care of them." Certified nursing assistants, underpaid, underappreciated, many of whom are immigrants to this country, minorities, people who have not been treated well by our society. They were heroes. They are heroes. The individuals being honored today represent those courageous, loving heroes. People who find a way every day to support the human spirits of those entrusted to our care. People who, in the darkest times, still find a way to love and to care and to help others thrive. And that, ladies and gentlemen, is worth celebrating. Thank you.
Thank you, Rick, for those inspirational words. And now I don't want to hesitate another minute. The moment we've been building towards, Carrie Liljadal will announce the names of our first 3 honoree heroes, to use your word, Rick. The names will be followed by recorded testimonials, and I hope everyone has their tissues ready. Carrie?
Thanks, Michelle. I don't even know how to follow Rick behind that, and that's not something I normally would say for anybody. Our staff is the most important thing in the world to our residents and to us who entrust our loved ones to them. One of the things I was able to say during COVID, and I was very lucky, that I knew even if I couldn't see my son, I knew every day that he was well cared for and loved by the people in the building he lives in. We're going to announce the first 3 winners today, and then we'll start the video. The first one is Jenny Ablings from Laura Hurst House in Portland, Oregon. And then we have Pamela long morning already. Cornelius Crosby from Arden Court in West Orange, New Jersey. And then Jamie Sanford from Aldersburg, Providence in Rhode Island. Not working tongue-tied today. So go ahead and we'll start the video.
Hi, my name is Nika, and today I'm talking about my mom, Jenny Aitling. She she was a hero to people at her facility. When COVID hit, she punched it right back in the face. She made sure that none of the people at her work got COVID, even her coworkers. And she when I was about before COVID hit, a few years before, she would take me to her work all the time. And I would meet all the residents. A lot of them were really elderly, and then and then the coworkers were really nice. They were really kind and very helpful to other people. And my mom made sure, she helped people through pain. She held their hand through pain. She held people's hand while they're dying, and when COVID hit, she was boss at the time of her work, and she was prepared. Well, kind of. How I already told you, she hit COVID in the face really hard and made sure so many people didn't get COVID. She made sure a lot of her friends didn't get COVID. She made sure a lot of her family didn't get COVID. My mom, I believe, is the hero of saving people from COVID-19. Bye.
Hi, my name is Lillian Kasha. I nominated Pamela Cornelius Crosby for the Above and Beyond Award. I met Pamela about 9 months ago. She's a certified nursing assistant at Arden Court's Memory Care Community in West Orange, New Jersey. She cares for my husband, who was diagnosed with young onset dementia at age 57. He is doing very well, and it is directly related to the care she is providing for him and her personality and her approach. I have learned so much from her. She is very knowledgeable, attentive, caring, and patient. She loves her job and truly loves the people she cares for. She makes sure they are having the best life they can in each given situation. I've never seen her raise her voice or get frustrated. The residents really listen to her. They are very comfortable with her. She carefully observes them and learns their likes and dislikes. Pamela is very upbeat. She has seen that the residents respond well to the positive energy. The first time I met Pamela, I was setting up my husband's room before we moved him in. She came to me and introduced herself and asked me what he liked to drink with his breakfast. That was such a big deal for me because my husband has aphasia. He cannot speak. She took the initiative to learn what he liked. Knowing that someone like her would be there and was so concerned about his welfare helps me with the transition immensely. When I learned about the award, I asked her what she did during the pandemic. I knew she had to be above and beyond. That's just her nature. She has such high standards. I thought her story was pretty amazing. First, being chosen to run the COVID house at the memory care community. Her location has 4 houses. One was isolated for the infected residents. She was on her own for the entire shift, separated from other staff members and not having any assistance from recreation or activities. She was so dedicated and did not take one day off. She had sole responsibility for the welfare of these residents. It was depressing and stressful. She was so happy to see some graduate out of her house and return to the mainstream. I chose Pamela for this award because I was so impressed with her and I had the most interaction with her. But I just want to say that the staff at Arden Courts in West Orange is unique. They are all very pleasant, and caring. I'm so happy to see how well my husband is doing there. This Alzheimer's journey is a difficult one. Pam is helping the family members just as much, if not more, than the residents. My prayers were answered. Thank you, Pam. Well deserved.
I'm Rick Gamache, CEO of Aldersbridge Communities in Rhode Island, and I'm honored to nominate Jamie Sanford for the Gray Panthers Above and Beyond Award. To me, Jamie epitomizes going above and beyond every day. Jamie was a social worker for about 18 years in a nursing home, and then she wanted to become an administrator. I don't know why, but I was lucky enough to hire her to run Lynn Health and Rehabilitation, which is the nursing home that's part of the Aldersbridge continuum of care. Now, they say timing is everything, and Jamie walked in to her first day on the job just as COVID hit the building. I don't know why she just didn't turn around and get back in her car and leave. And I'm grateful that she didn't. Instead, what she did was she jumped right in. She got her mask and PPE on, and she went up to the floors and began to talk with the staff, work with the staff. Do you have everything you need? Do you have all the equipment you need, the supplies? And she would build a rapport with residents, visiting residents. And you remember during this time, the Department of Health had mandated no visitation from families. And so Jamie set the tone for how staff members should interact with families in terms of the quality of the visit. She set the example, as she's done every day since then. She also built a solid rapport with the family members who were denied access to the building because of the mandate, but Jamie set up a weekly Zoom meeting with all the families so that we could share general information, and then they could have specific time with her or with any member of staff if they wanted. And of course, we also were able to facilitate virtual visits between residents and their family members. During COVID, Jamie set an unbelievable example with her compassion and her empathy. And now that we're kind of post-COVID, I hope, we can see even more of what Jamie can bring. She started a program to care for people living with Parkinson's. This is a huge need in our community. And she's had every single staff member trained in the basics of Parkinson's and how to interact with someone who's living with Parkinson's disease. Jamie also opened an outpatient rehabilitation program so that people from the local community and people from the assisted living and independent living that are on the same campus can have their rehab without leaving the building and have it from the same therapist that they had when they first came in, maybe as a skilled nursing resident. Jamie's always the leader, and a lot of her staff gravitate around her. They follow her because she's a compassionate leader. She's what we need in long-term care today.
Okay, we're going to take a break from the video, and it is now my privilege to name the remaining 3 honorees. Since Karen Campbell was unable to submit a recorded testimonial for her nominee, I'm going to read what she told us about Bobby Belasco of Continuing Care at Lantern Hill, New Providence, New Jersey. So what Karen wrote was, Bobby Belasco, a full-time evening LPN, juggles work as a single mother of 3 who copes with chronic kidney issues. At the height of COVID, while almost all our staff was out on quarantine, Bobby worked double shifts daily in the COVID wing without fear. After submitting her name for the Above and Beyond Award, I went ahead and was tested to see if I'd be able to donate a kidney to Bobby. Not only was I approved to donate, but against odds, we were actually a match. We are hoping for the transplant surgery to be in October or November. Well, that was a surprising development. We send our good wishes to Bobby and Karen on their journey. The other 2 heroes that we'd like to honor today are Marissa Silva of Dawn Hill Home, Bristol, Rhode Island, and Charmaine Thomas of Oak Crest Memory Care, Parkville, Maryland. So let's hear their testimonials. Emily, could you please continue the video?
Hello, my name is Charlie Galligan. I live in Bristol, Rhode Island, and I've been a daily caregiver for my parents, Audrey and Jack Galligan, for 11 years now. And I want to thank the Great Panthers of New York City for considering our superstar CNA, Marisa Silva, for their 2023 Above and Beyond Award. I can't imagine anybody more deserving of this award. We got to know Marisa in the early days after my mom suffered a traumatic brain injury, and we put her in a nursing home in our town. My father, Jack, was slipping into Alzheimer's. He came to live with me and my wife for years, and he was also a daily visitor to my mom. And Marisa just showed an incredible amount of compassion to not just my mom, her resident, but my dad, the daily visitor, and even put up with me and my helicopter care of my parents. And then when my father's needs increased here at the house, she came to supplement his care here. And then when we were all shut out of my mom's nursing home and had no more access to her during COVID, Marisa kept up following all the safety protocols, which, as we all know, was not easy. She would show up for all of her shifts at the nursing home and then still come to our house to help my dad. And that connection, since Zoom and phone calls didn't work between my parents at that point, the connection of Marisa between my mom and dad was their only lifeline, and it meant so much to us. She's a true hero. And in fact, when her facility was bought out by private equity, ultimately we had to move my mom, and Marisa was among one of the very few employees who survived the buyout and is still working at that facility today, due solely to her devotion to her residents. And she still finds time to help. My father's now died, but Marisa still finds time to help my wife and I care for my mom. And we're just forever grateful to her for all she's done for our family and thousands of other families over the years. Thanks, Great Panthers, for considering her. We love you, Marizi.
Hi, my name's Mary Miller, and I'm the Memory Care Manager at Oakcrest Village in Parkville, Maryland, and I'm very pleased to nominate Charmaine Thomas for an Above and Beyond Award. Charmaine came to us in January of 2020, and little did any of us realize it would be one of the hardest years ever to work in healthcare. But Charmaine rose to the occasion. In the very beginning of April, we had the first resident in our community with COVID in our memory care neighborhood, and the majority of our staff was put out due to contact tracings. But Charmaine worked day shift on multiple occasions, passing meds to all 40 residents, as people in the administration, including myself, were providing the personal care. She didn't just do this once. She did it multiple times, in addition to working her 3 to 11 shift, and that's certainly going above and beyond. Not only that, she also volunteered eventually when we made a COVID cohort to work there. And she did that so that when our memory care residents were sent there, they would have a familiar face. Charmaine's always thinking about the residents. When Charmaine comes to work, she's laughing and smiling and happy and dancing. And she's an inspiration to everyone, including myself, to do more and to go more above and beyond and do more for our residents. During dinner, to keep them engaged so that they'll eat more, Charmaine will sing and dance and keep them entertained. After dinner, she'll do karaoke with them, she'll put music on, she'll dance with them, but it's not just fun and games. Charmaine's also solution-driven. When she finds a problem, she doesn't just bring me a problem and expect me to solve it. She also comes up with solutions herself. She developed a program called the Grab and Go Bag Program. Charmaine noticed that when residents were going out for appointments, whether they had an escort or they were going with a family, they didn't have supplies in case they had an accident to get them clean. So she came up with a program where she did this all herself. She got the bags, she filled them with the supplies that the people would need to help their residents, and she came up with a place to put the bags and developed this program herself so that when someone was going out for an appointment, the family member or the escort would just grab a bag, and then everything they needed for incontinence care was in that bag. Charmaine works many extra shifts, including to this day. Her normal shift again is 3 to 11, but many times she picks up 11 to 7, 4 or 5 shifts a week. And there have also been occasions where not only has she worked a double, but she'll stay a few hours in the morning to help if we're really stressed and we need a lot of, and we've had a lot of call outs and we need assistance. Charmaine goes above and beyond every single day, and she does it out of pure love and joy. She gets joy out of caring for her residents, and it's so obvious and it's infectious, and she's a blessing to our neighborhood. So I really hope that you will consider her for an Above and Beyond award. Thank you so much. Bye-bye.
Congratulations to all of the honorees. It's been an amazing journey to listen to all of this. And now I'm going to pass the mic over to Carrie, who will be introducing Michael Brave. Carrie?
Hello, everyone. So Michael Brave is the CEO, owner, operator, and president of Southern Illinois Living Center, Brave Incorporated, and Southern Illinois Community Support Services, Inc. My son lives in these facilities, so I know Michael well. Michael, for the last 50 years, has been owning, operating, and managing residential facilities. A large percentage of our facilities are for adults with intellectual and developmental disabilities, and there's a skilled nursing side in our building also. Michael has been in the industry since 1988. Michael runs these facilities different than anything I've ever seen or heard of. I said to people multiple times during the pandemic, I knew where the money went because you could see what happened in our facility even without getting in. Our staff was being cared for because of Michael. So Michael's going to kind of give you an overrun of how we retain staff, because we have a very high retention rate. And I guess I keep saying we because my son lives there and it's his home as well as it is mine. Michael? You're muted, Michael.
Yes, thank you, Carrie. I appreciate that. That's really sweet of you. If I can, I'm going to share my slides. Hopefully. And there's a view.
Yep. If you go up to slideshow, right over to the right a little bit, right in the top. Sorry, the top navigation. It says slideshow. There you go, from the beginning. Yep.
Okay, there we go. Did that work? Okay. So as Carrie said, I'm really I'm very honored that she had asked me and you asked me to present today. You know, I've been doing this kind of work for the last 50 years, actually, and Clinton Manor has been 45 of the years that I've spent. I grew up there. I was 18, and it's a special place. As Carrie said, we support both people with intellectual disabilities as well as seniors in a small skilled. Today we support 33 seniors in the skilled and 51 adults with intellectual disabilities with very high medical personal care needs. So it really works well for us. And we also have 8 group homes where we support 34 adults in the community in group homes. Bottom line is we really believe that leadership has to start with a why, and that's been my philosophy all my career. I thoroughly enjoyed working at Clinton Manor at 18, working in all the departments and starting in the kitchen, and we have many staff that have done that with us. What's so important to our organization is we can have a good team if we have good leaders, and that we have good leaders that lead from an important why are we doing this and a mission, and that helps us engage and welcome residents, families, and get family involvement, because we can't do it alone. We need to work together. We also do a lot with the individuals we support, and many of them we've actually employed. We actually have some individuals with intellectual disabilities right now doing orientation with our new staff, as well as our annual training, talking about what it is to be a resident at Clinton Manor and what they need and want from a caregiver. We also have, we've also engaged in residents in working in laundry. That's important to them. So we want to find things that are important to the individuals that we're supporting. I guess some of the key indicators that we use to inspire our team is mission. It's so important that we have a good mission. And we started back in 1988 with everyone, including individuals we supported and their families and every discipline, in creating our mission as an organization. Our mission today is we passionately support each person in living a meaningful and satisfying life. Also, we believe that leadership is critical and good leadership is critical. And so we do a lot around training our staff and our leaders in being good leaders. We thoroughly believe in steward servant leadership, where the steward leader cares for the team, the organization, and society as a whole. Their actions are done in the interest of growth of the organization's mission, vision, and values, versus a leader that the team supports. And these are some of the tools that we've used over the years in our training for our organization. We also believe that when we select team members, from a housekeeper from a laundry person to a CNA to a direct support professional, that we need to find people that have good characteristic, good core competencies. And these are the core competencies that we look for when we try to select employees. We believe if we can select more people with this kind of competencies, that they'll stay longer because they work with us together and they work with the customer. As you can see, customer orientation is an important component of that. So these are the benefits that we offer employees. Many of them, a lot of places offer. I think what we have done over the years is to really try to listen to our staff. We do annual staff surveys, satisfaction surveys. We walk around, we talk to staff, we find out what's so important to them. We want to engage them. They need to be a part of our organization and help us understand what they need to be supported. And so, insurance, obviously, we try to build an insurance plan, paid time off. Those are things that a lot of organizations do. But we spend a lot of time on recognition. And recognition does not have to cost a lot of money, but where we put our money and our time is really recognizing the team that we have. And these are some of the things that we do when we recognize our staff. We have the usual celebrations, but we also go beyond that and have an annual banquet with a dance. The employees nominate each other. We try to get them to find characteristics in each other that deserves, such as you recognize people today. One real important thing is development of our staff. We believe that all of our staff are leaders, from the kitchen dishwasher to the administrator, and we want to help develop those skills. So we have a CNA class in-house. Many times we have a dietary staff or a housekeeper that comes and wants to become a CNA. What a wonderful thing. They've been inspired enough to want to develop their skills as a CNA. Many times we also have CNAs that want to become nurses. And so we support our team by giving them a scholarship up to $10,000 a year to become a nurse. We pay for our direct support certifications, which are the people that work with our intellectual disability individuals. The other thing during COVID that we recognized was well-being was so important. So looking at ways that we could support our staff in personal health, personal well-being, offering services that can help them build their health. And one of the things that I think has been very beneficial is we give everybody a $50 a month reimbursement for anything that they feel is important to build their health, whether it's a prescription, grocery receipt, whatever they want to use for well-being, we want to encourage. It's got to be individualized. We also have several different monetary perks, as you can see here. This year we offered a special perk with pick your own holiday, so that they could pick a day that they want to have off and be paid. Because again, it's not everybody's the same. The one big thing that I'm very proud of is that we offer up to $2,000 a year to each employee that needs a quick loan for an emergency purposes. You know, they got to get to work. A car breaks down, they didn't budget for it. They need support. So we can provide them up to $2,000 a year in a loan that comes out of their paycheck that they can pay over time to get to work, to pay that utility bill. It is amazing how many people just struggle with the stress of that need that kind of support. And we've been able to do that. And that has probably been one of our best programs. You can see there's other little fun. It's got to be fun. We've got to have fun in this work with the individuals we support, and looking at ways to do that together is important. We just recently had food truck day, and not only did the staff be able to go to the food truck, but several of the individuals that we support could also go to the food truck and have a picnic out in the patio or in their house and enjoy that food truck together. Let's see. So we also have a monthly newsletter. This is one of our latest newsletters where we always have to shout out and recognize our team members wherever we can. But communication to our employees ongoing is so critical in keeping our employees satisfied and want to stay with us. And these are just some of the some of the pictures of some of the pictures of some of our staff events that we have done, from training to ball games. Again, we got to have fun together, and looking at ways to support our team to do that, as well as our groups, our team does on their own the Alzheimer's Day walk. They raise funds, or buddy walk for people with disabilities. And not only is it the people that our team members that participate, but oftentimes people that we support participate in those kinds of community events. So as a result, what we've been able to have is the last 2 quarters of this year, first quarter, we had only a 16% turnover. The last quarter, the second quarter of this year, we had 6% turnover. We've been able to almost hire every position that we need. The hardest ones are the housekeepers, believe it or not, because they get paid less, unfortunately. Our longevity is wonderful. Our administrator and director of nursing have been with us for 23 years. Our ADON for 12 years, social services activities 20, and HR 8 years. 8% of our staff have been with us 20 plus years, and this is our 20 plus year staff. Just recently, instead of a billboard advertising our long-term care facility, we put this picture up thanking our employees. Again, recognizing as much as you can the team that you have. 21% of our staff have been with us for 15 plus years. Again, as I was saying, I think what's so important in outcomes is these trainings and helping staff develop in our field. 16 staff were supported since 2016 in nursing, and 12 of them are still with us, and several of them have become administrative nurses, ADON, nurse trainer, infection control coordinator. Our staff satisfaction has been in the 80s, even during COVID.
Well, Michael, I don't want to cut you short, but we want to get to our runners up, who I'd
Sure.
like to announce.
Yes.
So thank you very much.
You're welcome. Thank you.
And now we're going to show the photos of our runners up. Emily, do you have that? So,
How do I?
Michael needs to quit sharing his screen.
okay.
Yes.
It's okay.
I don't know how to do that though.
Bottom,
Yeah,
there
it's
should be a
okay.
button that says share screen or unshare.
Stop share.
There
we
you go.
Okay.
Great.
And you can see mine now.
Yes, we can. So, well, I will just briefly start reading the names because we also have our closing with Reverend Lynn Castile Harper. So, So those are the runners up. And just to let you know, Betty Bassie is from Milwaukee, Dave Salos is from Avon, Ohio, Evan Crowell from Silver Springs, Maryland, Jessica Collins Rogers from Oskaloosa, Kansas, Rowena Shepard from Maynardville, Tennessee, Elaine Smith from Quitman, Mississippi, and Vin Dong from Rancho Mirage, California. And now it is my real honor and pleasure to introduce Reverend Lynn Castile Harper, who is the Minister of Older Adults at the Riverside Church in New York City. And she will give us something to think about as we close today.
Thank you, Michelle. I'm just so grateful to be here today and grateful that Riverside Church has opportunity to partner with the Gray Panthers as our community partner. Before joining the Riverside Church as the Minister of Older Adults nearly 7 years ago, I worked as a chaplain in a nursing home for just over 6.5 years, working a lot alongside those providing direct, daily, and essential care. I witnessed firsthand how these carers are the backbone
What's up?
of residents' well-being, not only well-being of the body, but of the mind and the spirit. And that was during normal times. How much more so during this global pandemic? And so to the honorees, to Jenny, Pamela, Jamie, Bobby, Marissa, Charmaine, and the other nominees, I say to you, in the face of tremendous fear, uncertainty, and risk to your own health and safety, you have shown up for those in great need and offered the greatest gift, your compassionate presence and expert care, often when no one else did or could. Often with a little formal support, with a little public backing or awareness of the dire conditions you faced, you persisted, touching and sustaining the lives of each precious individual entrusted to your care. You encountered death up close and the helpless feelings of not being able to prevent it. Please know that it's okay to grieve and to mourn, and that we join you in that, even as we celebrate you today. Today, we have paused to honor and thank these extraordinary award recipients and to honor and thank all the nominees, each worthy of our collective admiration and gratitude. I'm standing today in a very special spot this afternoon. I'm going to duck for a minute. This is called the Mercy Window of the Riverside Church. It's in the very center, back in the very front center of our 2,000 person sanctuary. And what it depicts in the window are acts of mercy. This window was placed in the 1920s as the church was finishing and getting ready to open. Each panel of the window, of the mercy window, depicts an act of mercy. So there are figures providing food for the hungry and a cup of water for the thirsty, clothing the naked, housing the unsheltered, visiting the sick, and bandaging wounds. The reason this window is right up front in our large sanctuary is because in our tradition, as in many sacred traditions, acts of care and mercy are not just nice things to do. Rather, they are actually holy. They represent the most elevated, the most important acts that we can do for one another, especially those in need. This is what today's honorees have done and continue to do. Each honoree and all the many nominees are the living mercy windows, walking and living and working among us today. Their work is nothing short of holy. And so today we say to you that we see you. We honor and celebrate you. We commit to fighting for all the respect, pay, and dignity you deserve. And most of all, we thank you.
Thank you so much, Reverend Lynn. We are so moved. And I want to thank everybody for attending. And I think we do have one of our honorees here, Jamie. Are you, if you'd like to say something, or if you just, we're just honored that you made the time to attend today.
Yes, thank you so much. And thank you to the Gray Panthers for all the advocacy and work that you do to change and promote change for the older adults. And I really appreciate being recognized today. Thank you, Rick, for the beautiful words. Couldn't be here, couldn't receive this recognition without my team, an amazing board, an amazing CEO. This organization can move mountains. And that's what we intend to do. So thank you, everyone.
Well, thank you for being here today. And thank you to everybody. And please mark your calendars for next month, when coincidentally we'll be meeting on Halloween to host a program which is entitled COVID Put Long-Term Care on the Front Page, How to Keep It There. And our panel includes John Leland of the New York Times, Ron Roel, podcaster of 45 Forward, and Meg Laporte, founder of Age in America. So we'll see you all next month. And meanwhile, I would like to applaud everybody who was honored today and who attended. Thank you.
Thank you.